Infertility investigation in the uterine cavity. There are a lot of things that we can find, but due to the limited time, I was asked to talk only about congenital anomalies of the uterus. And we know that most of the congenital anomalies are asymptomatic. The frequency is 3.2% of the population. Most of them are septated uterus. You can see that in the normal population, the incidence is 3 to 4%. Do you see well? The incidence is 3 to 4%. It rises to 5% in infertile women, and it goes to above 25% after first and second trimester miscarriages and preterm deliveries. The clinical presentations are varied: menstrual dysfunction, pain, infertility and fetal wastage, obstetric complications, and don't you forget the renal anomalies that is coincident with the uterine anomalies. Ultrasound can evaluate both cavity and the myometrium, the uterine contour and the position, and of course the uterine tract. 3D ultrasound has the advantage of improved assessment of the size and shape of the endometrial cavity, multiple planes regardless of the uterine position, and the coronal plane is the most valuable. Do you see it well? I think there are too much light in here. Can't you turn the lights off? It's mainly an ultrasound presentation. If there will be too much light, they won't be able to see it. Anyone? Anyone?
Excuse me, the light should be switched off because the images are not clear. Huh? Somebody's going to put that. They'll be switched off in a little.
הקימו ועדה. Shall we move on?
Yeah, I think so.
Okay. So this is the normal uterus as seen by two-dimensional ultrasound, as you can see here. No, there is no there. Okay, no, it's okay. And this is the normal uterus using three-dimensional ultrasound. You can see perfectly well the uterine cavity as well as the outer contour of the myometrium. Here you can see 3 ultrasound reconstruction and multiplanar view of the endometrium, the sagittal plane, coronal plane, axial plane, and the 3D reconstruction. Okay, the American Fertility Society has classified the uterine anomalies into 6 sub-classifications: the segmental agenesis and or apoplasia, unicornuate uterus, didelphi, bicornuate uterus, septated uterus, and DEST-related. And accordingly, the ultrasound images are done. First of all, Rokitansky in 3-dimensional ultrasound, there is no vagina and normal uterus. Again, another upper, only the upper part of the uterus is seen, of the vagina is seen. And another case of Rokitansky, small uterus, no vagina, and the coexistence of pelvic kidney, uterine anomalies as well as urinary anomalies. Let's move to unicornuate uterus. You can see that in 2-dimensional ultrasound, you can hardly differentiate the unicornuate uterus, while in 3-dimensional ultrasound, it is perfectly seen and demonstrated. Another case of ours, this is the 2-dimensional ultrasound, but only when you do the 3-dimensional ultrasound, you can see only one uterine cavity. Another case with only one uterine cavity, and a very recent case with very narrow one unicornuate uterus. What about uterine didelphys? In 2-dimensional, you can suspect it by showing two different cervixes and two uterine cavity, two uterine cornea, very apart from each other. But you don't have to guess by using three-dimensional ultrasound. You can perfectly well see the two different separated uterus. Again, this is the MRI image of the Delphi uterus, and this is the ultrasound, that's three-dimensional ultrasound. You don't need MRI to demonstrate such a the Delphi uterus. Another case of two separated uterus, two separated cervixes and uterine cavities. This is, oh, thank you. This, I hope you won't go to sleep by now.